Dr. Frank is very impactful.
He listens to his patients. He listens to his colleagues.
He is one of the most supportive and just genuinely kind humans.
He is a doctor that puts the patient above all else.
Dr. Frank is the best doctor I think I've ever met.
Hi, my name is David Frank. I'm a professor of Hematology and Medical Oncology at Emory University School of Medicine, and I'm the director of the Division of Hematology. I saw quite a bit of suffering when I was a teenager, both in my family and in the community, and people who needed great medical care, and what we had wasn't quite good enough. And that really inspired me to say, I want to be part of doing better in the future. So my career is really focused on taking direct care of patients, generally patients with hematologic cancers like leukemia. And then the second part of what I do is to try to develop new treatments that were both more effective at treating people with cancer and caused fewer side effects.
My relationship with Dr. Frank is beyond wonderful. I was feeling like I had the flu for a couple of weeks, had no idea I had leukemia. I went through a series of different infections that I don't remember. I was in and out of ICU. Dr. Frank was always available to my family. Anytime they had a question, he was very compassionate, never ever in a rush. Knowing that he was doing research, it helped me to feel like he was on the cutting edge of everything. He knew everything, and he treats you as a person first, and then he steps in as a clinician after that. I would go in for an oncology appointment, and he goes, how are you doing? He wants to know, how is this affecting me emotionally? How is this affecting me psychologically? And you could really tell he really, really cared. I was terrified of a bone marrow transplant, and he just gently guided me through that whole thing. And so then I wasn't going to die anymore because I didn't have leukemia any longer because the initial treatment worked. So other than, again, thank you so much for everything that you did for my family and for me.
I was extremely honored to receive the Christopher Brett Wolfe Chair here at Emory. There are three major gifts that really came to me from this chair. The first is perhaps the most obvious, and that funds that come to my laboratory each year has allowed us to work much more effectively and quickly in developing new agents in the laboratory and bringing them to clinical trials for patients with cancer. It's allowed us to take high-risk, high-reward types of studies. But I would also mention two other gifts that have come from this endowed chair. I got to meet the people who funded the chair, Cammie and John Rice. And these are two of the most amazing people I've ever had the privilege of meeting.
So our son passed away in February of 2016, and 6 months later, my husband John was diagnosed with cancer, multiple myeloma. And when you're dealing with such grief, you're looking to take that pain and turn it into purpose, turn it into something meaningful. And Christopher, he was so curious and all about education and all about helping other people. So it made perfect sense to tie the two together with research and having a legacy for our son.
It's, I think, a wonderful way to recognize him forever. This professorship will never go away. David Frank is the wonderful first holder of the position.
And then maybe I could mention one third gift that came from this chair as well, Christopher. He had a smile that could light up a room. And although I never had the privilege of meeting him, I can tell you about that smile because I have a picture of Christopher sitting on my desk. And I look at that smile and I know the inspiration that he brought to other people. And every day I think to myself, okay, Christopher, let's go out there and see what we can do to make this world a little bit of a better place.
So, how do you put those into words to being meaningful? There's nothing better. Somebody goes out there trying to save lives in the honor of your son's name. There's nothing better than that. It's about investing in people. And when you invest in a person, and then you have the institution of Emory behind it, that's a return on your investment.